Okay, we're going to go ahead and call the meeting to order, and in recognition of quorum, we just got one missing. 6 of the 7 are here. Janina's absent, so we're good on that. And were there any questions with the new agenda that we're doing with the ABCD, which would be the approval of the agenda, the approval of meeting minutes, credentialing, and monthly payroll and claims? Were there any changes or anything that needs done with any of that stuff?
I move approval of the consent agenda.
I guess just before we do that, I did mention, that was quick.
Sorry.
I did notice on page 6, on the bottom, the local banks involved, there was one bank missing, and it happened to be Farmers Trust, if that could be added to that, along with Shelby County State Bank, Mid-States, and Defiant State. That's the only change there that I noticed, so now can I get a motion?
Yep. With that amendment, I move approval of the consent
I
agenda.
will second it with that amendment.
First and a second, all in favor?
Aye.
Opposed, same sign. Motion carries. Okay, number 4, we're going to have the medical staff summary from the Chief of Staff, Dr. Devine.
She's here. She's out of the office, so you're stuck with me doing that today.
That works, Nicole, thank you.
All right, so met with medical staff both May 13th and June 10th, so we'll report both of those today. The perioperative department began data submission to a Compass Sharp program, which focuses on reducing opioid prescriptions post-operatively. Nancy Gao reviewed the QI report for pharmacy and also let us all know that the fluid restriction was going to be lifted and we could move forward per usual with providing fluids. Adam Porter provided education on daptomycin and lisinoid antibiotics. Dr. Garten and Dr. Kelly Anderson are now regularly utilizing the Da Vinci for robotic-assisted surgeries. The medical staff approved the Red Cross contract, so that's a 3-year contract and it was due again this year. The rate on that increased approximately 4.2% for the next 3 years. Measles cases have been identified in Iowa, so as of right now, 3 measles cases, 1 in central Iowa, 2 in eastern Iowa. So we did push out some information via social media to the public on that. Stroke education was provided to those in attendance at the med staff meeting as we're working towards becoming a skilled stroke rehab center. The medical staff were notified of a couple of new order sets for medications. We did, Mary Peterson discussed Epic Welcome, which is an iPad that can be utilized. It'll be rolled out the week of July 8th, so when people come to their appointment, they can register that way or check in that way and fill out their questionnaires. And Dr. Tanya Padilla-Condi, she will be replacing Dr. Blue. So she has come out a couple of times now and been providing services to our community here. And we did provide a card to Dr. Liu. His initial start date here was November of '91, so he provided over 30 years of service to Myrtue. And then I do just need approval for our quarterly joint conference that occurred May 7th, so I'll pass this binder around here. At that meeting, we discussed a severe weather policy change. We added a Zone E in our emergency department so that anybody in the ED can stay in that area and just go to a safety zone down there. We also discussed, we received a $10,000 grant, as I mentioned, to become a certified skilled stroke rehab center. So our med-surg director, Sherry Schluter, and some team members from the med-surg floor are working on that to become accredited. Jason Eckerman reported no proficiency failures for lab. And the annual and quarterly policy and procedure manuals were reported and approved for the departments that were needed, and then core measures were reviewed by the recommend.
So can you explain that stroke thing? Tell me what that gains us.
Yeah, it's an accreditation, so it just shows that we can provide good care to these skilled stroke patients. So if you know what like Madonna or those types of places are, it wouldn't be like that. We're not going to be able to provide that type of care to patients, but this would be like maybe an elderly patient that just isn't quite ready to go home yet. They can come here and we will care for them. We really do that currently. This will just get us an accreditation for that.
Gotcha.
Yep.
Thank you.
Yeah.
Is that accreditation something that requires maintenance or?
It does. So it requires annual training for all team members facility-wide. And then it also requires, like we implemented some new order sets and medication review and things like that that will be taken to the medical staff here in the next month or two for them to approve and move forward with that.
So like this would be somebody that maybe possibly was transferred to the city, like, but they just need to be, they're gonna get,
Yes.
so like a swing bed, would they go to a swing bed in the interim? Like before this?
No, this would kind of be like
Like that.
the swing bed, yes. Yep.
Did you also have something with the American Red Cross, 3-year contract, Nicole?
Yes,
That's-
I don't have it to pass around. I mean, I do have this little piece here that just shows, it was just, our renewal was for 3 more years. So if you guys want me to pass this around, this shows the percent increase.
Do we need to approve it?
We do need
Yes.
to approve that, yes.
I'll make a motion to approve.
Well, we're going to do it all in one. We're going to do the
Okay.
approval of the policy and procedures and the approval of the Red Cross. Well, if nobody has any questions, we'll go ahead and get an approval or a motion there.
That seems pretty low, doesn't it? It's 4%?
It's
rate?
it's pretty standard,
Okay.
yes.
With everything else going up, I'm surprised it hasn't gone more.
Yeah, so it's an average of 4.2%. Some of the blood product is lower, some is higher, so.
Availability is still good?
Remains the same, yep. Yes.
All right, if there aren't any questions, can I get a motion to approve those two, the joint conference policy and the approval of American Red Cross 3-year contract?
So moved.
I'll second the approval.
First and a second, all in favor?
Aye.
Opposed, same sign. Motion carries. Okay, we're going to circle back to Laura on the quality improvement report, number 5 there.
Okay. 14 departments reported at the system-wide QI meeting, which was on May 21st. Some of the highlights from that are diabetic education reported that the A1C levels reduced from 8.7 to 7% post-education. Diagnostic imaging monitors that breast cancer screening recall rate as well as imaging recall rates. They were both well under the national average. Education had their big annual competency day for all nursing staff on the hospital site. They had 11 stations, variety of stations that all nurses went through, and that was very well received. OB reported no newborn complications. Pharmacy reported no adverse drug reactions. The Rural Health Clinic, we reviewed the January through April ACO, the numbers for there. We ended 2024 really good, and we're starting 2025 in the same manner. And then utilization review reported 100% of appropriate sepsis care for patients. So we had 5 patients total in that quarter that qualified for the septic diagnosis, and they were all treated appropriately. So if there's any questions, that's all I have.
All right. With no more questions, we will move to the administrative reporting, and we're going to go to the Chief Clinic Administrator, Kim.
Just a couple things to update you guys on. Everything's kind of focused around construction at the clinic right now. We have actually been able to see that they've broken through the areas that will tie the existing clinic in with the new clinic. So that's been happening. The windows in the existing space have been getting enclosed, and so just lots of changes that are happening. Slightly noisy, but not horrible. Still able to maintain patient care and doing everything that we need to do. Dr. Jonk will be moving here in the next few weeks, maybe even a little sooner. We've got everything ready to go, keeping patients informed. She will be out here where the temporary emergency room was, and now where cardiac rehab is going as well. So patients will enter in through the visitor space on the hospital side and be greeted at reception, and then able to see Dr. Jonk there. She'll maintain that space until the remodel of the existing clinic is done. So, and then Dr. Natalie Francis, yesterday was her last day until she returns 1 year from now. She's doing her fellowship, and then we'll welcome her back. So, unless you guys have any questions of me, that's all I have for you today.
Perfect. Thank you, Kim. Next, we'll go to the Chief Human Resources Officer, Jill.
So I have been providing an update on our
family medicine OB recruitment efforts over the last several months, close to a year. And one of our candidates that we were pursuing, she has declined Myrtue's offer, and she has chosen another facility that does not require a C-section. And so that's something that Myrtue needs. And so due to the tight labor market for both FMOBs and OBGYNs, we have decided to recruit for both. So we're going to continue our recruitment efforts of a family medicine OB who performs C-sections, as well as a second OBGYN. We will plan to hire one, not both, but that gives us the opportunity to broaden our candidate pool, if you will, in a tight market. So we're working toward that. I also wanted to share with you some of the work that we're doing with Manning Regional to provide OB services to that area as well, utilizing Dr. Kelly Anderson. She's providing services 1/2 day per month in Manning. And we have a co-branded campaign with Manning right now to create some visibility for Dr. Kelly Anderson and those services that she's providing there, primarily in a clinical basis, but then performing deliveries here. So there's a couple of pieces, Jeff, that I have in our folder that I wanted to share with the group. Just to give you an idea of what that co-branded campaign looks like, because we're doing some direct mailer pieces as well as social media, and we're extending our reach a little bit more so into that Manning and Denison area to create some visibility. So I'll show you what a couple of those pieces look like.
Which file?
The Manning marketing top folder. So the very first piece is a direct mail postcard. We really started these efforts here late May and now into June. So these are direct mailers that are going to a certain age group of individuals in the geographical area, but they showcase Dr. Kelly Anderson as well as their current, one of their FM OBs as well. And then the social media, you can, second to the last piece, there's a social media. Looks very similar, puts a face to Dr. Kelly Anderson, and you can see the co-branding between us and Manning in the bottom right.
So how does that work as one gets closer to their due date? Like, they have to go see the doctor more and more? Like, how are they getting those covered if she's coming once a week?
I mean, that's a good clinical question for Kim or
Maybe that's a question I need to ask.
So that is something that we've discussed. As they get closer and closer, they're going to be seen weekly or twice or every 2 weeks. And so the hope is that they can do a majority of their visits in Manning, but it might be that they do have to come to Myrtue to have those visits, and then obviously they would deliver here. And then the thought is that hopefully most of their postpartum care can be done back in Manning.
Gotcha.
Do you anticipate a half a day is going to be not enough?
I think that's typically just where we start with most of our specialty clinics and then just build from there. So she'll be doing surgeries in Manning as well as clinic, so we'll just start with that half day and see where we get with the opportunity to go a full day and maybe beyond there as well.
Does she get like a nurse to go with her through that, or?
So her nurse, who is her nurse here in specialty clinic, will go there and train the nurses in Manning. They do have OB-GYN experience there because they do have, like Jill mentioned, they have a specialist there now, Dr. Woods. So the nurses that work with him will be trained to work with Dr. Anderson.
Gotcha. That's wonderful.
Good job.
And I didn't have anything further.
Okay, awesome, thank you. Chief Information Officer Jeff.
Okay, just a minute, let me get all this back going. All right, I'll expand a little bit on Kim's update also on the construction for the rural health clinic. Sheet rock is being installed at a number of locations. The second floor is pretty much done with the sheet rock. They've actually primed most of the second floor and painted the door frames, so it's really starting to come to shape. There's one wall in the reception area that needs to be sheetrocked, but we had a slight change to it, and there's a lot of traffic going by there, so that'll be last, so that minimizes the damage there. The windows are all caulked throughout the whole structure, so it's becoming weatherproof. Their goal is to have it completely weatherproof the second week of July. So just a couple small areas that need a little bit more work. And obviously we have the big windows that are still open. They use that to pass through equipment and everything and supplies. I don't know if you've noticed on top, they've placed 2 air handlers. That was late last week they did that, so things are really starting to take shape. The hot weather, they actually have 4 large air units inside, portable air units that are keeping them cool. Also controls the humidity so they can mud and tape and it's not affected there. So over in Med-Surg, all the walls are up, the head walls are in. We ran into one slight delay in the flooring. That is set to be shipped in 2 weeks. I think July 6th is the date it's supposed to be shipped. It was supposed to be here June 6th, but the factory had a retooling and they're just recovering from that point right now. So their phase 1 would be the 4 rooms on the south side of the hallway. They're essentially ready for flooring. Next week, the bariatric lift gets installed, so a lot of progress there. The north side we're going to start the sheetrocking next week, and so we'll be essentially the same point. The south side will be in, the flooring can all go in at one time. Target to open that space up is July 25th or 31st, I think we decided this morning. And the 2 rooms 24 and 25, which would be the 2 facing this way by the nurses station, they're well underway and they're on track as of right now. So the 2 hallways there will be open at the same time, and then we just have the nurses station storeroom to finish after that. The cardiac rehab, as Kim had mentioned, Dr. Jonk's area, all right down that hallway. We have to install the toilets in those rooms. That should be done this week, and then everything in those spaces are pretty much complete. So finishing the flooring today, we have a small hallway that is only back office for employees to use. That is the last thing, the flooring to be done, but it's really looking good there. EVS, continue to move forward with that. Mary Ford's done a great job there. She's been here since March and changed a lot of things. Main thing we have going there is ensuring positions are full and staffed. We have had a lot of good response on our openings, so that's great news there, but still challenge at evenings. We have 2 openings in the evening right now, but we had one interview yesterday that said they prefer to work the evening, so great news there for us. On the IT side, a few months ago you approved the new door and video security system. All the cameras are installed, they're up and running and working really well. We expanded a few views so that we have better coverage. We added cameras out in the parking lot, which we never had before. So all of our parking lots are covered as of today. We're beginning to roll out the door access changes. In our current closets, there may be 8 to 10 to 12 controllers, which each controller manages 2 doors. And as you unplug one controller, it takes all of them offline. So we're planning to ensure, get everything in place so that our the doors will continue to operate as they currently do, but there'll be no updates to it until we get it into the new system. So we should see minimal impact when we are switching from one system to the other. The other thing that we're doing is getting ready to place all the computers into the new spaces we've got. I think we're adding 70 computers throughout the whole, so we're getting those ordered and creating an image so that when they come in, we can get them built and pushed out to the appropriate locations. So any questions there?
Is there any updates, Jeff, on Peterson Family Wellness? Are just on?
Yeah, sure.
They're just short.
Yep, no, thank you for reminding me of that. Today, we started draining the pool. The liner company is going to be in later today or tomorrow to look at the liner. We do have, I think in 3 weeks, we approved the new filter. That's when that is scheduled to be done. So they're moving forward there. There's also another project that is in the approval process to add I believe it's a CO2 filter or CO2 system to the pool water, which will improve the management of the water and will allow us to use less chemicals. So we have about a 1-year ROI on that, $5,600 total price on that. So some good things going on there. The way south of the property, all of those pine trees were cut down earlier this spring. Grass seed has been placed over there, and we've been watering that to ensure that it's going to grow and come back in, fill in real nice. Our long-term plan for that south side is to get a bush that'll grow 8 to 10 feet tall and just have a row of bushes there kind of for privacy or splitting from the country club, the condos there, and the facility.
Thank you. CEO Barry is next.
So we do need to approve, the board needs to approve 2 trustees to serve as board members, board of directors for Shelby County Medical Corporation, and that would be a 1-year term running July 1, 25 to June 30 of 26. And right now I think Terry and Janine are serving in that capacity. So just need approval from the board to appoint them for that period.
Second.
First and a second, all in favor?
Aye.
Opposed? Same sign. Motion carries.
Do you have a PowerPoint for me? Maybe. So I want to get approval for the Shelby County Medical Corporation contract for physician services, and maybe go to the next page first. So our the arrangement that we have, and this is production-based, so we contract with Shelby County Medical Corporation for physician services in the hospital, and it's based on a kind of a production-based, I guess so we use RVUs. So let's go back to the previous page. So an RVU is it's part of the resource-based relative value system, which is a measurement system developed by Medicare to estimate the resources used to provide services in a medical practice setting. And this has become more common use in physician production-based compensation. So that's what we use to determine how much to pay Shelby County Medical Corp. If you go back to the previous page, so our current contracted RVU rate is $110 per RVU. And we are proposing to increase that to $113 per RVU for that July 1, 25 to June 30, 26 period. And we're estimating the cost of that to be about $6.8 million. And that includes all of our local physicians, general surgeon, OBGYN, podiatrist, all of our family practice, primary care physicians, as well as some of our contracts with specialists. So our GI, our ENT, ortho, ophthalmology, pulmonary, all of those physicians are contracted through Shelby County Medical Corporation. And there's other costs associated with running that organization, like there are some administrative costs, some insurance and travel and dues and some other costs as well. So I'm asking to get approval from the board to amend that contract to increase it from $110 per RVU to $113 per RVU. And I think we've got a SCMC board meeting later this week, and we would get approval from them at that time.
Just a question, 6.8 is the new, do you know what last year's or this current year was?
6.3.
6.3.
So it's
Does that cover our malpractice insurance for those doctors also in that?
Yes. Yeah. So we are We are seeing some, I guess the increase probably is mostly due to the orthopedic coverage. So we do anticipate having a little more ortho coverage. We also have a new provider budgeted into that. We did just budget for 1 year, kind of making an assumption that we'd have somebody on board by January 1. So that's where probably the increase, most of the increase comes from.
The number of RVUs per year is relatively constant, or is that on the increase as well?
I'd say it's been pretty consistent here lately, but, I think over time it does, we have seen some increases. We've started to do more with specialists, and so I think that's where a lot of the increases probably have come from.
All right, any more questions on before we do the approval of the?
I should, since I'm
Oh, you're the board trustee. Yeah, I probably should have someone else.
Use yourself.
Okay.
Then I'll move approval of the proposed RVU rate at $113.
Got a first, how about a second? First and a second, all in favor?
Aye.
Opposed, same sign. Motion carries.
So I did want to give you kind of an update on some of the things that's going on with Medicaid legislation, because it could potentially have a large impact on Myrtue Medical Center's reimbursement. So the House did pass the One Big Beautiful Bill. Has many changes to Medicaid, and I'm not going to go into that detail, but did want to talk about what the Senate is proposing. So now they're working on their legislation and their proposed changes, and they've released some of those recommendations, and would be pretty devastating reductions to a lot of hospitals, well, throughout the country, but certainly in Iowa, rural hospitals. Not just rural hospitals, it would affect urban hospitals as well. And IHA has looked at this, and they're estimating about a reduction of $730 million annually to the state of Iowa. And a lot of that has to do with the state Medicaid direct payment program that's been implemented in the last 2 years, 2 to 3 years. So it would have some definite impact on that. And I think the main areas are there's a cap put in place on the provider tax provision, which is basically the way Iowa pulls down more money, Medicaid money from the federal government, is by implementing this provider tax provision. But they put a cap on that. So that does have some impact, but I think the bigger impact is that they're capping Medicaid reimbursement at the Medicare rates. So that's part of that provision. So yeah, overall, looking at about $730 million. For Myrtue, we're estimating that would be a little over $2 million a year. So obviously could potentially be a very big impact on our operations. The Senate would have to pass this legislation. It hasn't been passed yet. And then, it would go back to negotiations between the House and the Senate and see where we end up. But I would say it's probably going to be somewhere in between, the Senate and the House's version. And either way, we're going to see some negative impact on our Medicaid reimbursement. So just wanted to give you a heads up on where we are with potential impact on that. Any questions on that?
If something did pass, it would probably not be effective until next year?
Probably October 1.
Or October.
I did want to pass on some of the foundation grants, Shelby County Health Foundation grants that we've gotten recently. For the emergency room, they did $300,000 over 3 years for that project. And so we're just getting the last grant from them, which is $85,000 in 2025. And they also did a $300,000 grant for the RHC expansion. So our first installment will be in 2025. of $80,000. So just wanted to let you know that we are getting some funding from the foundation, and obviously we appreciate all their support. So I think that's all that I have then.
All right. Next, we got Christie with the approval of the 2026 operating and capital budgets.
Okay, so I included in your packet the overview of the budget. For the operating budget for fiscal year 2024, really the growth is based on growth of services. We have significant marketing efforts are underway to educate patients on the addition of the MD West 1 for orthopedic surgery. As Jill had mentioned, the outreach for surrounding areas for OBGYN and the benefits of having robotic surgery here. So a lot of new services in our outpatient area. We are budgeting for net revenues to grow 9.6% from the anticipated $62.4 million to $68.3 million in 2026. And again, as a result of additional services. The total expenditures in the budget to increase 12.7% from an anticipated $59,467,000 there in 2025 to $67 million in 2026. That's a result of, as you know, a lot of our supplies are going up significantly. A lot of medications are going up significantly. Contractual obligations, we have more PSAs, the SCMC, the cost of our staffing, and that is going up. And now that we do have the ER online, we are doing depreciation for that, so that hits our financial reports, and we will have depreciation for the RHC when it gets in place again in December of 25. So those are the majority of the increases. We do build into the budget an increase as of January 1st for staff, an estimate for that. But we do take that review into play in October, November when we get the IHA surveys. And we also take a look at where we are financially at that point in time. So we are, proposed budget accounts for net income from all sources of $2.4 million for fiscal year 2026. Then just kind of go through the capital. We can do these together. We do put together a 3-year capital budget so that managers can kind of keep in mind what's coming up. And we usually set priorities for this next fiscal year at items that are really aged out or that we're really having a lot of problems with getting fixed or anything like that, or that we need for growth purposes. So we put together that priority budget for, this has changed a little bit since your packet went out here. The priority budget was at $4.5 million, but we backed that down to $3 million with the anticipation of pushing MRI off to 2027. So we would be looking at $3 million is what we'd be asking for a budget to spend on those priority items. They still do, as you know, policy is that anything over $100,000 needs to come to the board for board approval before we commit to it. So that still takes into place. This is just kind of sets a budget limit for us for capital budgets. So the Finance Committee met on June 9th and went into more detail with the budget. And we had conversation at that time, and they recommended that we bring it forward to the board for approval.
Did we take out the assumptions then for the Medicaid Advantage money going forward?
There's nothing in here for the Medicaid. There's no reduction in Medicaid Advantage in the budget at this point in time.
So we'd have to, if that gets passed, we'd have to approve an amended budget probably at a later date.
If we are seeing a reduction in revenue and we need to watch our expenses a little bit more, we generally don't do a budget amendment. If we're going to lower our budget, we would just do it if we increase the budget. But of course, we would monitor it and reduce where we can if we need to. Like I said, a lot of this is, there's almost over $500,000 of this is in depreciation, which is non-cash. So, that's an increase that really doesn't, it still leaves us the cash flow, but it affects our income.
All right, any other questions for the approval? If not, can I get a motion? First got a second?
Second.
First and a second, all in favor?
Aye.
Opposed? Same sign. Motion carries.
Thanks for your work on that, it's a lot of work. Put this together.
it is.
Like, it's understated.
It's kind of a year of investing in some of our new resources too, as maybe we like to try and hold the revenue and expense increases about the same, but this year is an investment into, getting the robot fully enhancing enhancing with ortho, enhancing with OB, and sometimes you have to invest to grow in the future and reap the benefits next year or the year after,
Let's talk about that. Can we ask that question? How's that going? Are we seeing some increased services, like with the robotics? Is that happening?
Yeah, Kelly Anderson is doing a lot more robotic cases, whereas she either would have done them just plain laparoscopic or had to send them outside of here. So we have seen an increase in that. And then Dr. Garten, he uses it for every single surgery. Not every single surgery he does, but every single gallbladder surgery and hernia surgery. That's all he uses.
And we're seeing good results from that.
Yes.
Patients are really happy.
Absolutely, the outcomes are fantastic. We've really noticed a lot with Dr. Kelly Anderson patients. I think at some point we can probably definitely do those as an outpatient procedure. We've just been keeping them because that's what we're used to right now, but their pain is definitely much more reduced than laparoscopically.
That's wonderful.
So we haven't gone over the April financial reports yet, so they were in your packet. So just comparing 10 months is our fiscal year in April. So April of 2024 compared to April 2025, we continue to see increases in our outpatient visits. We're at 5,328 for April compared to 4,967 last year. ER visits, 465 compared to 401. Surgical procedures are 112 compared to 148 last year. Physician clinic visits were 3,470 compared to 3,659. Behavioral health visits were 1,295 compared to 1,716. Our average daily census was 5.75 compared to 6.74. We had 4 births this in April of 2025 compared to 7 last year. Net income from all sources, there you can see we were at $567,000 for the month of April this year compared to $1.1 million last year. Year to date, you can see we still see an increase in our outpatient visits of 5.4%, ER visits at 1.9, surgical procedures are down 10.1 in April. The physician's clinic visits for year to date was up 3.6%. Behavioral health is down 10.7. Still seeing a couple positions that are not filled currently. Our average daily census, as expected, is continuing to go down, where it's down 6.6%. Our births are up 36.4%, so great results of OB and our OBGYN. And from all sources, we're at $4.6 million in net income compared to last year at about $4 million last year also. So about 15% higher. I don't know, it was in your packet, the 4-year, we can go ahead and go to May. Why don't you go to the PowerPoint? So you have the comparative 4-year information. We're going to look at May now. There was an error on that one, so I fixed that, so that's why it's not the same as the one in the packet. So May, which would be our 11 months ended the end of May, so Monday is our fiscal year end on June 30th. So for May of this year compared to May of last year, we're up again at 4829 for outpatient visits compared to 4618. up year-to-date 5.3%, so we're up to 55,790 outpatient visits. The emergency room visits, we were pretty consistent for May of this year, 485, 489 last year, up again 1.6% year-to-date. Surgical procedures, we had 115 in May of this year compared to 105 last year. So we are up to 1,254, which is down about 8.6%. It's about what 118 there is. Surgical procedures were down. Physician clinic visits were at 3395 compared to 3391 last year. We're up 3.3% in our physician clinic visits. Behavioral health was 1161 compared to 1458, down 11.7%. Average daily census was 6.43, pretty consistent with last year, down 6.4% for the year, so we have 7.19 patients per day on average. We had 10 births this year, 10 births last year in May. We're at 96 this year so far through the end of May, and 76 last year, so it's a 26.3% increase. Net income from operations from all sources there, in May of this year was $35,000. Last year was $157,000. Year to date, we're at $4.6 million. And last year we were at $4.1 million, so we're up about 12.2%. And I think if you click on that 4-year, we can kind of go through that just to kind of compare. So year to date, we compare the last 4 years, and you can just continue to see we're staying consistent everywhere or going up, except for in a couple areas there, mostly in the average daily census, which is a trend that's going to be there based on insurance, driven by insurance. Kind of looking at some other things right now with swing beds, so maybe we can turn that around a little bit. Net income from all sources, you can see there we're pretty consistent, lower there in 2023, but last couple of years have been pretty consistent. Any questions?
All right, with no questions, can I get approval of the April and May financial statements?
So moved.
First,
Second.
and a second, all in favor?
Aye.
Opposed, same sign. Motion carries. Okay, now Kate's got a update on the CEO search.
Yeah, just a short one here. Mike and I have had a couple of Zoom calls with the representatives from Whitkeefer, and they're fielding all the applications for us, as you might remember. So they gave us 7 viable candidates to look at. There were a lot more applications than that, but they vet them first so that we only see the people that meet our qualifications. I mean, you might be surprised that people who are, flipping burgers at McDonald's apply for Barry's job. So it's important that they weed through all of those. So they explained to us that although they brought 7 candidates to Mike and I to take a look at their resumes, that it's a fluid process, and so maybe some of those will drop out. They expect to have more come in for us to take a look at. And so we meet every 2 weeks by Zoom, and so we'll keep moving on the process. Any questions?
When do you anticipate having people in, like, when you narrow that field down to a couple different candidates?
We're not in a huge hurry because this is still June, and we're keeping Barry till the end of the year. So I think we're going to take our time on that and really let them go through all those candidates. My guess is it would be fall.
Okay.
All right, any other questions on the CEO search? Okay. Did you have anything else, Barry, before we go into closed session?
No, I don't.
Okay, so we're via per Iowa Code 21.51. Can I get a motion to go into closed session?
I move we go into closed session.
Go first. And a second, we'll do roll call.
Zimmerman, aye.
Norgard, aye.
Frederick, aye.
Kate, aye.
Beaker, aye.
Terry, aye.
All right, with roll call made, we're going to go ahead and go into closed session. Thank you.